Good day, Dr. Eels from Family Medicine Department. Today I want to talk about 5 important S's for the examination of the diabetic foot. Number 1, shoes. Number 2, shape of the foot. Number 3, the skin. Number 4, sensation. And number 5, supply of blood to the foot. First thing to remember when you're examining the diabetic foot is that history is extremely important. And the history of those 5 things, you need to cover them in the history. Ask the patient about shoes. These shoes are probably not the only shoes that the patient are wearing. So you need to ask about the shape. Is there any known deformities in the foot of the patient? So you're going to ask about the patient's skin. Has the patient ever lost any skin on his foot? Any previous ulcers? Or, God forbid, amputations? Those things are the high risk things for diabetic ulcers. You're going to ask about sensation, neuropathy, pins and needles, or loss of sensation. And lastly, the supply of blood. You're going to ask about any known peripheral arterial disease. Remember smokers, or if there's any claudication. Good day, sir. I'm Dr. Eels.
Hi.
How are you?
I'm well, lady.
Good. What is your name, sir?
I'm Respect Mukwen.
Welcome, sir. Do you mind if we examine your feet?
No, it's fine.
Can you lie down for us, please? Okay. So like I've mentioned, we start with the shoes. Check the patient's shoes. Is it clean? Is it comfortable? Does it give support? Okay, look at the shoes, very important. The next thing is the shape. Look at the shape of the feet and the joints. See if there's any abnormalities, any obvious problems that you can see looking at the shape. So the next thing is the skin. Skin includes not just the skin of the foot, but also any corns, calluses. Remember the nails. There's often fungal infection of the nails. Look between the toes for any fungal infection between the toes. Okay. Next thing, next S is sensation. So there's 6 places you can do a quick screening test for sensation on the foot. So this is the small toe, the middle toe, the big toe of the left and the right foot. So I'm going to ask you to close your eyes and I'm going to touch your toes. When I touch your toes, please just say yes when you feel me touching your toes.
Okay.
Okay?
Yes. 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 Yes.
This is just a screening test. Monofilament is also something that you can do, but it's often not available. The last thing is the supply of blood to the feet. You want to check the pulses. Okay? So we're going to look for the dorsalis pedis pulse. And also going to check the posterior tibialis pulse. In summary, remember these 5 things when you're examining diabetic foot. The shoes, the shape, the skin, the sensation, and the supply of blood to the foot.